Bridging the rural healthcare gap, the University of Illinois College of Medicine in Rockford highlights the need for providers while building hope for the future of healthcare. WIFR News reporter Sydney Stoffregan talks to the director of UIC's Rural Health Professions, who says integrated technology could be the key to providing accessible care for all.
The Centers for Disease Control and Prevention reports that the 1 in 5 Americans living in rural areas are more likely to die from things like cancer, unintentional injury, and heart disease than those living in more populated areas.
Maybe we get a few more folks to understand really what it means to embrace the power of rural.
That's the goal of Thursday's Rural Health Day event at the University of Illinois College of Medicine, Rockford.
There's opportunities to improve sort of just general healthcare delivery for rural so that people don't have to travel the distances just in general for primary care or any other need.
Hannah Hinkle, the Dean of Rural Health Professions, explains rural populations are often older, sicker, and poorer than their urban counterparts. Without access to good care, the window for detecting a health issue is often cut short.
So it's really challenging, I think, to maybe make a holistic approach to addressing some of these issues, but if we don't address them, we're going to continue to see poor outcomes for rural people.
The ability to connect with the community on a personal level is what led Avery Cassie to rural medicine. She says the future of smaller workforce healthcare is paved with technological advances.
What sort of tools folks are already using and whether or not we can implement new tools based on current structure. So figuring out the best way to be efficient while taking advantage of all this incredible new technology that we do have.
One consulting firm reports that only 5.2% of Illinois providers work in rural areas, a number UIC hopes to improve.
We recruit intentionally students who have a rural background or from underserved areas who then go back and practice medicine in similar communities to where they're from.
The College of Medicine's Rural Professions program provides medical, pharmacy, nursing, and social work education specifically for the areas that need them the most.
Thank you, Sydney. And since 2011, the National Organization of State Offices of Rural Health set aside the third Thursday of November to celebrate the power of rural. This day honors the efforts of rural health care providers and communities while shining a light on unique needs.